All right, so it's still morning, or doesn't it feel like it? And I think I'm maybe standing in the way of us and lunch. Is that correct? So I'm going to make this as quick as possible. My name is Phyllis Hill. I am the lead organizer with Isaiah. First, I want to say something about myself, and then I'll tell you a little bit more about Isaiah. I'm originally from Hazelhurst, Georgia, which is a small town, a very rural town, about 100 miles away from Savannah. I grew up in a county called Jeff Davis County. So, for you over here on the West Coast, do you know who Jeff Davis was? Who is he? Or who was he? Yes, he was the president of the Confederacy. So, Jefferson Davis, we just knew him as Jeff. But, I grew up with my grandmother, who was an educator. She was a teacher for more than 30 years. She had the opportunity to teach in the segregated school as well as the integrated schools. And so growing up with her, she always would say, you know, there's something that we lost when we integrated. And I would say, like, I would just kind of, you know, just be confused. Well, what do you mean? What are you saying? Surely my education is better now that we are integrated. And she would say, you know, we haven't produced any black PhDs since we've integrated. And when we had the segregated schools, we had so many students going off to getting their masters or their PhDs. And I thought about that for a long time, and it always just stuck with me about what happened. What happened that my education seemed almost deficient? And why is that? Didn't we win in some ways? Wasn't that what the civil rights movement was about? So I say all that to say she is right. Something was lost. A lot of that has to do with the nurture of black children and the love of black children. You can't actually teach black children without actually seeing their humanity. I take that into my work. So this is not something that is merely just talking about community organizing for organizing's sake, or I'm going to talk about this health impact assessment. This is almost very personal in some ways. And it definitely has a bloodline, a lifeline that I bring to this work. As far as I've been working with Isaiah for 7 years now, 6 years, almost 7 years. And by the time I came to Isaiah, and Isaiah is a faith-based nonprofit organization of 100 congregations. So our members are congregations. That is in the Twin Cities, in Minneapolis and St. Paul, and out in greater Minnesota. And Isaiah had been working on basically, they had a public health nurse that was a part of one of the congregations who really pushed for Isaiah to look at the social determinants of health. So while that push was happening, there was also an internal and an external push in Isaiah to look at race. And that if Isaiah was ever going to win or have actually to be a transformational organization, they were going to have to look at race squarely in its face. All right? So all that kind of happened at the same time around 8 years ago. So as Isaiah began to develop in that way, one of the main values that Isaiah had was about integration. And it's a deep value that Isaiah has. And it's not just about the integration of schools, it's also about the integration of communities, of our societies, of our city. And so around 2011, or let's say in 2010, Governor Dayton was elected, and he's Democrat. And the two houses were Republican. And we have something called the Integration Revenue Funding Stream, which is about $180 million. And this money is supposed to help schools with integration efforts. Now, this money wasn't necessarily being used for all of that, but all of the schools were strapped for money, so they were using it as, you know, as discretionary money, basically. And so the House and the Senate decided that, hey, since this money is not doing what it's intended to do, and we have this huge economic, we have a huge economics gap, but education gaps in Minnesota, how about we repurpose this money? Isaiah and other organizations said, wait, if we're going to repurpose it, we better well have communities of color at the table, and we also have to talk about equity. And we also have to talk about these disparities, and we also have to begin to redefine what integration is. So not just kind of what is happening in the classroom, but what is happening to our society, what is happening to our state in Minnesota. So we began to look at the health impact assessment as a way to open up that conversation. How do we talk about integration more fully? How do we talk about equity more fully? So the HIA we saw was a tool to begin to build a new narrative to address some of the harsh realities in Minnesota. Okay. So Minnesota's racial inequities, there are a lot. You wouldn't necessarily think that about Minnesota, but we rank near kind of the top as far as the racial gaps, or disparities gap across the board, whether that's health, education, joblessness. We rank up the top. So we believe in Isaiah that obviously something should be done about this, but we're actually going to need the power of people to change this. And as you can see here, 56%, and at the time, this number has slightly increased, but 56% of African Americans and only 58% of Latinos students in 2013 graduate from high school. So community organizing. I know we've been talking a lot about that, but I want to go a deeper dive into it for Isaiah. We believe that is a set of disciplined strategic practices to build democratic and collective power to assure the conditions in which communities can thrive. We do this through extensive leadership development and grassroots leadership, as many people have been talking about today. Also building democratic and accountable and sustainable community-driven organizations. In order for this ecosystem to actually survive or actually to grow, you actually need sustainable community organizations, not one that's a grant away from closing doors. And also, we also believe that community organizing also has to have the links between health, economic security, and equity. Just down here in the circle, this is kind of an indicator of how we do our work. Much like many of the other organizations, we do our one-on-ones, really getting to know who's in our pews. They get to make the decisions about what we should do, what research we should do, what actions we should do. That kind of is a cyclical kind of approach. There's also the 3 phases of power, which are, we believe that in order to tackle these things, there are 3 phases of power that we have to have. And it's not just about Isaiah. We also believe that this whole ecosystem that we've been talking about has to be able to embrace and build, which is direct political involvement. We have to have people at the Capitol. We have to have people at City Council. We have to have people on the school boards, or at least engage in the school boards. Organizational infrastructure. This is nothing more than base building, making sure that our organizations are strong, not just one, but many. And also ideology and worldview, which is the narrative. So again, part of what I'm going to talk about is the HIA as a tool to be able to enhance our narrative. So integration in Minnesota. Basically, the racial segregation in Minnesota is getting worse. It's not improving. So when we look at a school, we can have an integrated school system, but what happens is on the east side of the school system, on the district, it's all white, and on the west, it's people of color. So there's that. So you can have integration. You can say, hey, there's a diverse group of people who are living in proximity of one another, or who are in the same town. But when it comes to kind of in the schools in themselves, they're being segregated. And even in a school, there is segregation. So that may mean that you have a lot of kids of color that are in not in the advanced track or the college prep classes. There's also one other thing that I would like to bring up on this slide, which is there was a task force. So when the House and the Senate wanted to do away with the money or to repurpose it, there was a task force that was set up, both by the governor and the commissioner and the House and the Senate, of 12 people, and of which Isaiah, being involved in the 3 phases of power of the direct action, basically monitored that process for a whole year, looked at the recommendations and basically gave voice to the recommendations, what was good about it, what needed to be included. One of the things that we definitely wanted included was more money for these efforts, instead of capping it, because they did cap the money. And then also we said, hey, why don't we do an HIA on the recommendations? So our health impact assessment was on the recommendations provided by the task force. The process and the outcome was very important to us. It wasn't just about doing the HIA, it was about how we were going to do the HIA. So it was about who was at the table and the people at the table, did they understand equity? And if they weren't going to understand equity, then they probably shouldn't be at the table. If they didn't understand power, if they didn't understand community agency, then this is not the table for them. So it was very important that even how we set up the process, that people who were invited understood that. And that they understood that that they would ask questions, because we know that research is driven by questions and who's asking the questions, that it'd be a very diverse group of people who are asking these questions. And also one of the outcomes, we definitely wanted to make sure that this research was co-owned and created by the stakeholders. Another goal is just the iterative work between research and organizing and redefining integration in school choice. This was a rapid HIA, which means that we only had like 3 months to do it. So it really kind of relied on the skill of organizing. And what I mean by that, our relationships. Who could we quickly organize to do this work? And one reason why it was a rapid HIA, because we were doing this during the legislative session. We wanted to make sure that the recommendations were provided by the end of the session, so the legislature could make a decision, through a health frame of passing the legislation for the integration funding. So our stakeholder panel, as you can see here, it was made up of Isaiah members who were teachers, also part of the school district, board members, people who were doctors, medical doctors. I would like to say that we didn't necessarily achieve all we wanted to achieve as far as the diversity. And what I mean by that is that, yes, we had black people at the table, but we didn't have any Somali people at the table. And that's very important, as Minnesota is one of the largest places outside of Somali where Somalis actually reside. That would also go for Asians. So there was even a challenge in our relationships, in our organizing about how to do this process equitably. So integration. I also knew that as I was organizing this, that this was very personal for people. This wasn't some abstract academic conversation around integration. One of the people who was actually at the table, this was actually her first, she was actually part of the first wave in Minnesota to integrate schools. It was actually during this process that for the first time publicly, she was actually processing her own story about what was happening to her. So even as people were asking questions about just about people's experiences, were they positive, were they negative, you could actually visibly see on her face that this was the first time she was actually processing this. And at some point, she was very courageous actually saying that. So the room could give her a little bit of grace to to learn what had actually happened to her. We also saw integration as should be a transformative definition, not steeped in whiteness. So most of the times, integration is only defined by a segment of the community that basically leaves out black voices or people of color voices in defining what integration truly is. Also, what came up was racially isolated schools. So in Minnesota, we all know that it's predominantly white. But you can have predominantly white schools, and they're just schools. You have predominantly schools of color, and now it's a problem, and they get labeled as racially isolated. So this is something that in Minnesota is actually a big deal. So on one hand, you could be white, and you could have your schools, and it's fine. You have a school that's all Hmong or that's all Somali, and it's seen as a problem. We also took the definition, we really love the definition provided by John Powell around integration. And I really kind of just wanted to read the last part, which is, that is, while desegregation assimilates minorities into the mainstream, true integration transforms the mainstream. And that's really kind of what we're hoping to do when we say changing the narrative. Can we look at integration as truly transforming the mainstream and welcoming everyone to the table? In Minnesota, there's also something that's called the Choice is Yours program, which means you can it's open enrollment. You can go anywhere. The problem with that is that then your choice is limited by your access. So if you're a parent and you work all day, or you have 2 or 3 jobs and you're a single mom, are you actually going to have the time to actually pick the school that is best for your children? So what we definitely said is that due to disparities in income, wealth, and employment and other resources that are correlated with race, access to choice then becomes racialized. Another hot button discussion with the HIA is, we did have the Human Impact Project to do our research. So when critical race theory came up, it was basically the community challenging the research practitioners on, one, what were they reading? Why were they reading it? How are we reading it together? And does it fit in with our community and personal experiences? And essentially, who owns the report and who owns the research? So this was a very kind of tension-filled conversation we had, because basically we were challenging the researchers to think in a different way and not to just reinforce the dominant narrative around integration or reading just standard materials that reinforce the dominant narrative. So this is our impact summary, and I think you can find this in the handouts if we have them, which is, at the end of the day, if this were to pass, and it did pass, and you would actually look at integration more holistically, you would find that through educational achievement. So let me back up here. There are 2 things that we really look for, and it was the school integration's impact through educational achievement. So if we were to pass the school funding, what would be the impact on educational achievement? What would also be the impact on cross-cultural connections? So those are the 2 things that were really studied in the health impact assessment. And so what we find is that through the educational achievement side, improved health of life expectancy, mortality, improved health behaviors, increased jobs and income and impacts, and it would decrease stress and obesity. On the through cross-race connection, it would also improve mental health, decrease trauma, improved health behaviors, and improves physical health. And there are some other things. So obviously this would be a very positive for the health of Minnesota, not just for students, but for the whole state of Minnesota. This slide just shows our community organizing efforts to partner with Representative Carlos Mariani, he's the chairman of the Education Policy Committee. He expressed his gratitude for this work because it began to open doors for him to talk about education more holistically through a health lens. He kind of expressed his frustration of looking at education funding incrementally, not looking at the whole picture. So our outcomes to date is the Minnesota Achievement Integration Program. It did pass. This also opened up avenues for the commissioners of health and education to begin a discussion around starting a health in all policies. And a health equity report did come out by our Department of Health that looked at structural racism as a key barrier to health. So so our work basically was the impetus for more work to come. And then there's one other thing, which is, or 2 other things, integration rule. This was one of the big recommendations that we made. The DSEG law in Minnesota basically says that it's not tough enough, basically. And so if you want to desegregate schools, right now there's no incentive for you to do so. And matter of fact, you receive more money when you don't. And so what we said is that the rule needed to be tightened. So right now they have a task force to redefine or to relook at the definition of the DSEG rule. And right now our president of our organization, Reverend Paul Slack, sits on that task force. And also there are more HIAs coming due to this work. So the Minnesota Department of Health, basically we're in the midst of passing a bill that would allow the Department of Health to do a health impact study on school discipline policies. So, thank you.